Okay, we are live now.
Okay, all right. Thank you.
Yes, this is week 12, Devendra.
Okay,
Week 12.
all right. All righty, let's see if we can start. Okay, everybody, welcome. So we're going to talk today about some of the research, and just I'm going to mention some poses because we're going to have a gap from now for a few days. And I thought I'd just go over some of the poses more just as a refresher when you actually do the poses and the mudras. So we'll talk a little bit about those. I know that leave them for later, but just so that we stay in sync with what we're talking about. So yoga and meditation studies in thyroid disorders, okay? All right. So again, remember that what we talk about is complementary, not alternative. So while we're going to talk about things and data and results and comparisons, we're not going to say that you don't need to see the doctor, don't need a thyroid hormone. We're not talking about a cure. I know sometimes we see hear those words. I think just be careful. Some language translation and cures very, very hard to ever promise, even with medicine. So we're going to say that these are complementary and not replacement. We can hope the doses go down, and of course, prevention and easier ride, but not sole treatment. Why yoga? Why would it work? Why would yoga, meditation, mudras have any role? Well, in general, we know, and we'll talk about how chronic stress, your stress, the cortisol, the things we talked about, can impact your immune system and also affect your hormonal axis. We talked about the other axes before. This one's with the hypothalamic pituitary thyroid or HPT axis. I had 2 or 3 of the axes before we talked about. And so when the system is not working well, then you can get autoimmune thyroid conditions because the immune system is dysregulated. And then these are, of course, physical, mental, emotional aspects of well-being, quality of life, and might negate some of the negative symptoms from impaired thyroid disorder. And then, of course, symptoms. So you can even help your symptoms like fatigue, anxiety, depression, and weight issues. So there are multiple ways this could help. We'll talk about a few of them, but you can imagine there are multiple ways that this can help. All right. So generally, the axes are very similar to the other ones with the adrenal gland and cortisol we talked about. So you have the hypothalamus, which is when we look at the center here, has releases a thyroid releasing hormone. We heard about it from Dr. Raj yesterday. That then releases in the pituitary, which is again in the same sort of plane, the thyroid stimulating hormone. So the releasing hormone releases the stimulating hormone, right? And that is under stress control. So if I'm stressed, that'll affect its levels. That then, the TSH goes to your thyroid gland and then releases the active hormones, mostly T4, T3 goes to T4. So T4 is the one. And every cell responds to this by increasing its energy burn or decreasing energy burn based on what the cell is doing and the action occurs. So, of course, very important. We need this organ to work very, very well. All right. Okay, so I think it's a very straightforward chart, and of course, stress and cortisol plays a big role. So many are probably already thinking about how specifically yoga could work, or pranayama would work, or preksha would work, and I think you're going to find a very similar pattern to the other sessions.
Dr.
So,
what is TSH? Is that
thyroid stimulating hormone? Yeah, thyroid stimulating hormone. So first is thyroid releasing hormone. Mm-hmm. That causes the thyroid stimulating hormone to then go up or control it. And then when it goes up, that goes to thyroid hormones, which are the T3, T4 to go up. And they're the ones that we talk about. When you take a medicine, you take a T4 version of the medicine, levothyroxine. When you do blood test, is a TSH and a T24 you measure. That tells you whether your car is working. Yes, Sachin, go ahead.
Sorry, quick question. Is there supposed to be a difference in so the bottom two where it's the image of a person and it says metabolism and energy? Um, is there supposed to be a difference with the one on the left and the right?
Yeah, one on the right is not enough, is calm, cold, and the one on the left is high, and therefore you're
Okay.
burning more energy. It's just illustrating how it can go up and down. And
Okay.
to be honest, even when you talk to me now, every moment you're doing anything, it's adjusting up and down, and it adjusts up and down constantly. Mine is
Thank you.
within normal range. All right.
Thank you.
All right. And then mechanism of action. So again, we talked about reducing stress, right? So by activating the parasympathetic nervous system, the rest and digest, again, we all know that, right? Parasympathetic is Ida, right? Right is sympathetic, left is parasympathetic. That's why we do this Anulom Vilom, or how we control that. The same system comes to play here. So by reducing stress, you activate the Ida, or the parasympathetic effects, and they will, as we know from other sessions before, reduce your cortisol levels, and therefore, and also reduce the burden of the axis we just talked about, hypothalamic, pituitary, thyroid axis. We also know that certain asanas can improve blood flow in thyroid. We know that everywhere we improve blood flow, we get better function, better supply of oxygen, which it needs to work better elimination of toxins, and we regulate the organ better. So anything that improves the blood circulation organ will help enhances effectiveness, not high-low, but balance, I would say. Now, neuroendocrine regulation. So meditation may influence the secretion of other hormones. We just talked about the TRH, the thyroid-releasing hormone, to the TSH, the thyroid-stimulating hormone in the pituitary. It has many other hormones that are called ACTH, which is a big one. That's the one that relates to your stress hormone cortisol. It also regulates that, which then helps your axis function. So very integrated and fluid. And if I help something situate, everything situates better. So you remember the vagal tone, right? Vagal tone. We looked again, Pingala, Ida, how we control our heart rate, control our GI, pain. It'll come up again and again. So this is the same theme, really. Your increased thyroid hormone, hyperthyroidism, that's common, as Dr. Raj mentioned just today, tends to increase your sympathetic activity. That's your Pingala. Your fight or flight response. That's the one you want to go up when I'm running, or running away from a tiger or a snake. And when I'm calming down and suddenly disease where the thyroid is low, it enhances my parasympathetic, the rest and digest. However, both extremes are wrong, right? As Dr. Raj mentioned, hypothalamic heart rate goes up, you get flustered and confused, and you're going to maybe collapse. Whereas the parasympathetic is too much, not imbalanced, then you'll get constipated and distended and swollen and lethargic and sleepy. So the balance is important, and what we try to do with yoga is just get into that balance. That's the balancing act. All right. So there are quite a few studies on hypothyroidism, randomized controlled trials, what we like. We mentioned the trials where you've got a group that has treatment and a group that's not. So we can be objective, not because I'm hopeful it works and I have an effect on goodwill, and the patient has goodwill with me, and I like your doc and just feel better. And I don't know whether it was the medicine or the goodwill I have. So randomized controlled trials sort of eliminate those things, so we get a more true picture. Again, they're very well designed. Some are not best, but at least we have them. So really, summary, which will go on through the study, shows that a significant improvement in the quality of life. So when people apply these and have these diseases, their quality of life improves significantly, particularly physical, psychological, but also social domains of interaction, and consistently over studies. They all show reduction in symptoms, particularly fatigue, depression, anxiety. There is some modest but measurable improvement in biochemical parameters, such as reduced TSH. Remember the TSH, which we talked about, that controls your release of thyroid. And then also, one of the things that low thyroid does, it also affects how you digest your lipids, because lipids are fuel. If my cells are not burning the fuel coming to the cells, then my lipids will go up. So my cholesterol and triglycerides, which you don't like, go up. And of course, obviously affect your heart or the vessels. So when you do meditation, then these profiles also improve. And then, just your occasional study did show reduced medication requirement. Again, you don't want to promise this because it depends so much on person and the goodwill and so many other factors that we want to just be focusing on the other benefits that are themselves very important. Right, one of the controlled trials that I want to talk about is a hypothyroid females, a randomized controlled trial, RCT. For 3 months, they had a yoga intervention, not too dissimilar to what we would do. And they used 2-armed studies, so basically 60 women, about 30, 31 each. And its effect on many things were looked at. And it improved the thyroid, which is the LT4 meta profiles, and the supplemental thyroid reliance is how much dose you need. It decreased, and also helped sleepiness and depression. So its studies have indicated that you could or should include this in the armamentarium to help these patients. And because it's low harm, easy to teach, they recommend it's a very important intervention to consider. All right, this is a summary of similar studies, in this particular and other studies, and you can see the green. It's a little difficult to read, so again, I'm going to show you these plots with a little bit of a heavy heart, but I'll try and help you with them. The green is a yoga group, and the blue is the control. And these are the conditions. For example, BMI is body mass index, and you see in the yoga group it goes down a little bit, whereas in the control group, if anything, it stays just a little bit. So it seems to help there. And the values that tell you it's a true effect, not just a visual effect. Now, cognitive affective depressive symptoms, which is your depression scores. The green shows, again, negative. This line is 0, so you can show it's dropped, which is a good thing. And controls are more or less unchanged, maybe slightly better. So if you go down, the LT4, which is dose of thyroxine, in this particular study decreased compared to controls. If anything, it went up. Controls other people with thyroid diseases, but didn't have this intervention. So again, I would worry about this, and I would just take it home and say, therefore, it's going to work, but it suggests it is beneficial if somebody does a good job and focuses. We talk about the lipids, HDL, we already know, depression score, cholesterol, and then we talk about the sleepiness. You can see sleepiness in green has dropped significantly compared to the control group. So this plot summarizes the data here very well. It actually is for this study, not combining others. The others a bit complicated, so I kept it just for this study. And this other, go ahead.
Sorry, what does LT4 stand for?
That is your levothyroxine. So when you make thyroxine in your body, we call it T4. When I give you the medicine to supplement, is levothyroxine, we call LT4. Good question.
Thank you.
Yeah. So you can see here that another way of presenting is how these other things are improving this one. This is your control group with hypothyroid on thyroxine, and they're kind of all these symptoms there. But you can see that when they do yoga, all these things are improving. This difference is kind of telling you how much improvement you're seeing. It's quite a visual. So really, it's a pretty powerful technique, and it was done in India where they taught properly, and the compliance was good. They went every day, so it's a very well done study. Okay. Another a study showed 90 minutes yoga sessions 5 times weekly, and they also showed reduction in TSH and increase in active T3, and their depression score also improved. So again, it's a consistent finding. Akhtar in a study used WHO markers over 6 months for quality of life improvement, and they showed significant improvement in energy and sleep. And the psychological domain showed marked reduction in brain fog and fatigue. So, what they noted is that yoga doesn't fix a gland; it repairs the patient's daily experience of health. Also, it's kind of like helps you in your normal life. All right, so we'll move forward to some of the aspects. Again, we're going to cover this because there's a gap. I thought I'd just mention them so you can kind of connect with the talk, but then at some point we'll go over them with Rameshji in a proper way. So generally, these studies use these poses and combination of these poses. Sarvaga, as we know, the shoulder stand, which I think probably is the best one, and that somebody just told us, Bina just told us that it creates a firm chin lock and increases blood flow to thyroid. And this is something we're going to practice more and more of in January. The plow pose, halasana, some of this we don't remember, just look them up. And of course, we can look at our notes. Fish pose, we know Matyasana. Ustrasana, which is the camel pose, which we just did that very recently with Rima. Cobra pose with Rima, Bhujangasana, and Setu Bandhasana, the bridge pose, which we did also. So these are ones we don't really comfortable, and anything that we think we're not familiar with, we'll cover. But these are general poses they use. So probably some variability in the studies, but these are commonalities in the poses they've used that there's evidence for, if you like. All right. So generally, the concept is compression and stretch. So lots of studies employed this compression, the shoulder stand, and the stretch, thinking that the squeezing will squeeze the organ and squeeze your blood out and toxin out, and then you stretch and the blood flow goes in and fresh blood goes in, plus oxygen goes in. So you're kind of flushing it in and out and helping it get better perfusion. In the results, usually over 3 to 6 months, they're about 6 to 90 minutes long session. These are just one of many, it's not just this one. And about 4 or 5 days a week. And the key thing the study shows consistency is more critical than the perfect pose, which again, all the teachers tell us that do the best you can, but yoga can be a compromise and still called yoga. That is, you don't have to be the perfect pose. You just have to work towards that, visualize to realize, but it's the attempt doing it, persistence that works, not perfection per se. Right? And perfection probably will help, but that's not going to be the reason not to do it. You do it as best you can as to get benefit. All right. And so meditation, so we'll talk about meditation. The studies just the meditation separate, though mostly they're combined. So it's really hard to know who does what, but there are some studies of meditation. And generally, they're more mindful meditation or transcendental meditation techniques. And we have some work on Pratyahara also. But I'll talk about Pratyahara some other time. But they're not RCTs, they're good studies, but you need to be randomized to really be able to tell others. Others are promising. What did this stress-thyroid connection? Well, when you do meditation, your cortisol lowers just for meditation, not the yoga part. Again, enhance immunity, which we can show with blood tests and functioning. And it improves mental health, particularly anxiety, depression. So again, it has its effect. And Visuddhi chakra visualization is one of the common ones that they mention in studies, which of course we do with Swamiji. And as I say, studies on mindfulness, which is basically praksha, trance meditation, another technique, and then the guided imaging focusing on the throat chakra, the Visuddhi, which we also practice. Now, don't forget, when we talk about treatment disease, we shouldn't forget that this can prevent also. So it, in fact, may be even more important to consider this a prevention tool. So if you have family history of heart disease or some reason why you've been high risk but don't have it yet, it would be important to apply these techniques. Studies to show whether it works prevention, of course, would be difficult and would need to be done, but you can imagine that if I work my thyroid this well, I visualize it, I keep it healthy, right? I stop it from getting sick. And that may be the real power of this. As opposed to treating and curing, it may be preventing maybe even a bigger role because there's so many at risk. And you can start early and age, and you can avoid and delay it or perhaps never even get the disease. That I think I would be quite comfortable stating that you might even avoid getting the disease. All right, so this is one of the plots. Again, this is just to kind of show impact on TSH levels, right? Remember TSH, when we asked with thyroid stimulating hormone that comes from the pituitary and then tells your thyroid to then release thyroxine. This is yoga on TSH levels, okay? And this shows you that at control group, there was hardly a difference as you expect, nothing really changed. But in the yoga group, you got a good, almost, if you look at the baseline, almost 20-25% reduction. So it's a pretty impressive level of hormonal changes. And as we mentioned, that reduction in the hormone helps also with your, it helps also with your lipids, so cholesterol and triglycerides. So very beneficial. Okay. Any questions on that?
Yes, sir. Is there any timeline for how much this yoga was conducted for the control group or general group?
Yeah, the control group did not get yoga. They'll get regular therapy.
Okay.
And the control had yoga. So this is the effect of yoga. Does that answer your question?
No, how long they do the yoga?
This one was 3 months.
Okay, 3 months. Okay.
And they do for 60 to 90 minutes, about 4 times a week.
4 times a week. Okay. Thank you.
4 or 5 times a week. And important there may not be 69 minutes, it's the 4 or 5 times a week, to be honest. If you persevere and persist, that is when you start seeing the true benefits.
Yes.
Okay. Right, next slide.
Yes.
Of course. What are the evidence we mentioned that transcendental meditation can also reduce the base, apart from the thyroid, it also reduces the baseline cortisol level, right? Which we want. So I'm chronically less stressed. I'm chronically hurting my organs less, and my organs prefer not to be chronically stressed so they can perform their business. When they're stressed, they have a stress response to help my stress, right? So let's say my cortisol goes up, right? Because I'm watching a movie and I'm getting very anxious, and somebody's going to get killed, and get into the movie and I get really heart rate goes on. The cortisol is to tell me that I'm in threat and I should protect myself. Right? It doesn't know I'm watching a movie. That cortisol is going to then tell my thyroid to work hard to give me the hormone to allow my cells to burn the fuel so that I can ready to run or whatever. Now, I'm not running, I'm just sitting there. I'm just watching a movie. So now I'm damaging myself. I'm increasing my lipids. I'm letting lipids in my vessels. When I'm stressed, my platelets get sticky because I'm thinking in a wild world, when I'm stressed and running, I might get bit or scratched or get cut. So my platelets want to stop the bleeding. So they get sticky and ready to stop my blood bleeding. Now here, the platelets have nowhere to go. They just clog my arteries and they'll make my arteries narrow, which means they're going to affect my blood flow to my organs, right? Not just your heart, all your organs, your brain. So every time I'm watching a movie, I'm getting stressed with a bad or a horror movie and I'm actually hurting myself. So there's things you can do about it, but just think about it, right? That's what we do. Now, in real life, it happens all the time. At work, I'm going to work, I'm stressed home. That chronic stress, when I'm not using it, is very damaging. That's one of the reasons why business executives get heart attacks. This is why dentists get heart attacks, chronically patient, high volume. And they're some of the highest people because they're chronically stressed, okay? So we want to control that. Mindfulness-based reduction, which is really what perception is, and pranayama sort of to extent gets you there, improves your well-being and also reduces markers. And then overall, the evidence points to meditation as a potent regulator of stress response. And again, we'll touch on this with the other diseases we're coming at, and at some point we get to explore it so well three-dimensionally, you'll be very comfortable with these concepts. Mudras, there is studies of mudras. Mudras are, of course, stimulating, as somebody said, your nerve endings or points. And, there are various theories of how they may work. But, they have a role, as we know. And by connecting, so each of these fingers and connection nerves, they have a source in the brain. So it could be when we do that, we're affecting a source, which is a stimulating blood flow there, which affects areas there, which then help those part of the body. So I can even imagine as a physician how it would work, even without the meridians, which I also have to accept. So for the thyroid, there's special mudras that seem to balance the throat chakra and regulate the endocrine system. One of which is this, and it's been studied, interestingly. So in this one study, they just used this mudra, the Shank mudra. We looked at that, right? We studied, and we'll practice it again. This is more to illustrate rather than practice today. And the TSH also reduced after 2 months. And basically, this was not a control study, it's a case study. But somebody doing Shank mudra consistently can lower that. It's suggestive. So again, I mentioned the best is a randomized control trial. These studies are more like your first phase or second phase where theory looks like may work. But to prove this team would have to now move to a randomized control trial that have one group that does Shashank and another group that does both have the same medication. That's okay. And the other group has standard therapy, though. There are other ways to improve the model, and then you could show the benefits. So again, why I suggested, I'm showing to you, this is why you can't really sit on this data. You just suggest what you may want to do one day to prove it. You cannot use it as proof. It is suggestive. Okay. In hypertension, so yoga and hypertension, there are fewer studies, just because it's less common and a little bit difficult to, I guess, collect enough sample size. The primary goal of hyperthyroidism is to calm the nervous system. So you want to calm it because somebody's hyper. Don't forget that the thyroxine is high. So they're saying they're telling all your cells to burn fuel more for some purpose, but it's no purpose. So you're now burning fuel as if you're going to run a marathon or run a mile or race somebody, but you're not doing that. So your body is kind of burning fuel. It's like your car in the garage burning fuel and exhaust collecting, and it's not good for you, but it's not going anywhere. So that's what's happening. So then you get anxious because your heart is up as you're anxious to run away from an animal. Heart rate goes up to supply blood flow in case you get cut, bruised, so you're going to fight, so you're ready. And because of the heat you're making, you can't control heat, so you feel very sweaty, uncomfortable, and you can't sit, you're constantly moving. So basically, the RC yoga used calming yogas because you don't do any heating poses or once they increase your Surya, if you like, or Surya bed you don't want to do. Shoulder stands should be very cautiously done and may not be suitable in this setting. And so generally, there's some studies, but you would want to work more on the cooling, which is a pranayam, as we already other for women's diseases, restorative poses and meditation. A little less in yoga, unless it's relaxing yoga.
It's like Chandra Bedi pranayam.
Chandra Bedi good, but not Surya Bedi, absolutely correct.
Yes, yeah.
Cooling pranayam, Chandra Bedi. Thank you, Vinay. Okay. Any questions on that? So yeah, sorry, I did another slide on that. So Shitali, which makes sense, right? Cooling, Shitkari.
Sitkari, Sitkari pranayam and Chandra Bedi pranayam, and always alternate breathing is good in every ways. Whenever we do for both the brain, it helps both sides, right and left. It gives equanimity. So thyroid will be in balance with the hormone secretion. And Sarvanga asana is topmost, but if some people have health issues, then they can do camel pose, which helps your thyroid also when you bend your neck backwards. So that gives the effect on your thyroid gland.
Perfect. And these are then specific targeting versus the overthyroid, so slightly more for that. And in terms of the pranayama we talked about, Brahmari is the other one they mentioned, B breath. This is the nervous system. And then the postures, the restorative poses are like the bridge pose, leg up the wall of Viparit Karani,
Viparit Karni.
and reclining bound angle pose, which is a Supta Konasana, which we did do.
Butterfly.
And then the gentle forward folds, like Uttanasana, which is standing forward bend, and Paschimottanasana, which is a seated forward bend, can be calming. Again, you could predict that, right? From what you know. You wouldn't make it all of them right, but you can predict some of them, as Binavan said and taught as well. So they help also in general, and meditation also helps for managing anxiety and irritability. So you could help a lot with the symptoms, particularly while they're undergoing therapy treatment, not quite got low thyroid treatments going on. You could support them well.
And one of the excellent pose we did was fish pose. Matsendra, Matsyasan. And with the crossing the leg, also it helps your neck right away, thyroid and brain.
Yes. Fish pose is a very
Yeah,
good
fish pose. Yeah.
Correct. Any questions? Anything else? You understand there's a subtle difference between hyper, which is active, Graves, the one with the big popping eye, anxious, eye level, and the hypo, which we talked about before. Make sure you keep that clear in your mind. Good. This is a infogram I made just because Rakesh likes this. But basically, you could use this. So you've got an image, you've got your thyroid, and you've up top yog, the asana and pranayam. We know that the RCTs have shown into TSH, this thyroid-stimulating hormone, which messages your thyroid hormone, relax or get overactive. Then you've got T3, which is one of the active thyroids. The body mass index, which is weight loss. Quality of life, which is how my daily living is, and reducing stress. So it's been gone through that to help the thyroid and the curves. Plus and right explain the scores in one of the studies that we talked about and illustrate how much improvement they saw. Meditation is mindfulness pratyadhyan, reduces stress hormone, cortisol, improves mental health and immunity. And we know that pratyadhyan improves gene expression, which is some work that we've done. And here it's under Samraj's guidance, so we'll present that at some point. And we know that there's effect on thyroid cancer patients also. So it's not just hypothyroid cancer, also during treatment and post-treatment, you can actually help. And then we talk about mudras, the shank, and of course, Gyan Mudra is the other one. And while these are case studies showing TS reduction, we can't assume it's real. That person may have improved for some reason, don't know. So, but it does suggest that we could do a study, and this would be a good area to study and see if we can actually show that in a randomized control trial. Okay, and lots of references I was interested that support the data that we just presented. Good studies. And these are more recent ones. I didn't go too far back. And there's only one study that's going far back only because it's on transcendental meditation, and it's a longer one. However, there are some studies with pratyadhyan. But again, as I say, we have to figure out if they're randomized, but certainly we have them. And we'll use some of the studies with pratyadhyan data later. We'll go over those also, make sure we understand what they have, what could be fixed, what we should add, and how we could maybe expand. If someone's interested and want to work with me later, we can try and plan studies, simple studies to show its efficacy, nice randomized control way. All right. Any questions on that? Anything that I can go over to clarify any confusion? This is time to ask.
This was great.
Thank you.
Yeah. No, I appreciate that. I think these will be good on the back side of the list of things to do. So you can have like I'm always so glad you suggested. I think this is going to be very helpful to have this in the back. And, it's clean, and it's caveat, so you can actually use it as a tool to guide people. So good. Any questions about the disease? Anything else that we can cover today? These are the poses, I think. Maybe as you can talk about that. Let me just see what poses do we use.
Sarvang Asana is good.
Yeah, there's a list of them, and maybe you can just talk about them. I just couldn't find it. Interesting. Should find. Let me just scroll down quickly.
Yeah, I have the list. Sarvangasan, Halasan, which is the plow.
Perfect.
Matsyasan,
Yeah, there.
Ustrasan,
Matsyasan.
Bhujangasan, and Setubandh Asan.
Yeah. These are common ones.
These are the ones. Yeah.
These are all of them.
Usually,
These are common ones.
usually in yoga, basically when you split all kinds of asanas like sleeping, standing, sitting, that will harmonize all over the body in all perspective of disease. So it's good to practice even other asanas also, but we'll still do like for specific disease we can introduce like 2 poses, but as a whole package we should practice in 1 hour. Like all we have to do sitting, some of them like Paschimottanasana, Janu Sirsasana, in standing balancing pose. So this all helps in one way or other way, or in any kind of disease like thyroid, hyperthyroid, or diabetes. So any disease is all interrelated, all asanas basically. But we'll give a therapeutic also, some of them like 2 benefits of like say Sarvangasana helps for thyroid gland, for example. But as a whole, it's good to do all practice of asanas. That's what I would say.
Yeah. And to your point, Ramesh, when he covers this with his from Acharya's book, that'll have that listed, and which mudras. It even we didn't want to cover that, but certainly if you want to explore further yourselves, it has mantras also. Because of the secularity, we've decided to not sort of cover the mantras because we can confuse our clients. But for you individually, at some point we'll probably have those mantras listed somewhere so you can have it for yourself. But yeah, I think and many will help. So it's just knowing which ones you're going to talk about. If someone asks a question, well, these are a few I'll talk about for this context, a few, but they all will help. So it's more selecting. It's like only exercise helps. And so I think important point there, very important point.
Binaben, I don't remember the Halasan.
We have not done, but in January, Anuja is going to do in class. It's called plow pose. So once you know Sarvangasana is later you can do Halasan, but these are all challenging poses. So I will recommend that once he introduces to you, after that you practice every day at home, because practice will give you more flexibility and ability to do the poses. That's why. Because the next in January, all poses are very, very important in health purpose. But as a first time, you want to then keep practicing to achieve the goal of the asanas. So that's important. Then online, you can do with Rameshji also, Sarvangasana practice, Viparit Karni, all those. But that January is all the second level of asanas you will be learning. So that will help. So it's like a plow pose. So if you do Sarvangasana, you just bring that both feet towards the ground, that becomes the plow pose.
Okay.
Once in Sarvangasana pose, overhead. So it's like
advanced level of Sarvangasana.
Yes, it is opposite of Paschimottanasana. It will look when you bend your both. It's like a plow. That's why it's a plow pose. Yeah. But once you achieve those poses in that manner, you can really feel in the thyroid gland. But if we cannot reach the perfection, that's why we get less effect. But once you start practicing and get more flexibility, you can experience those effects in your body. Uh, that's why it is therapeutic, because you have to achieve the goals of the asanas as well to get the perfection of it. But it gets by practice, of course, as I said. But first we should learn properly, and then you can always get flexibility in period of time.
Thank you.
The important
But
thing
it
about this
takes like
is,
6 months. It takes 6 to 8 months for to get poses. So don't worry initially that you, oh, I cannot do. Don't worry about it. You just need to learn the techniques, how to lift your body up to do Sarvangasana. First, you need to learn techniques, and then you try to achieve little by little, getting more flexibility with the practice. Like, for example, you're doing 5 pounds, then you're doing 7 pound weights, right? You increase the level of your exercise. That's how asanas you improve the flexibility by practice. So then you get the effects in your muscles, your gland, and everything. It starts activating at that point.
only thing I would, we talked about compression and relaxation of the thyroid. You can see this do that, right? Shoulder send compresses, this compresses.
If
This
you get
stretches.
that L shape of Sarvangasana, you can right away see the thyroid effect right away. If you get that pose, you can really feel it.
And this stretches, so you get blood flow. This compresses, and undo it, blood flow. This is blood flow. This again is blood flow, right? This compresses and stretches, right? Cobra does kind of, and then gentle stretch next. So you can see why
Yeah.
it makes. If you had to look at it and say, you probably would pick some of these, even if you didn't know, right? From what you understand already. You
Yeah.
know, power makes sense, but it's logical. You know, if you somebody asks you, use your logic, you probably get the answer without memorizing because it makes sense.
Like say, if it, for example, if you face a obese person in your class or obesity, they cannot lift their body. It's not going to be easy. So in that case, you start doing your cobra pose, camel pose. So they're not restricted from the benefits. That's our goal. So we want to help people in any ways. So we have to just figure it out what poses we should select for certain people. That's why we say, right, special population. That's the purpose. And if the people can do and doesn't have high blood pressure, like even if it is maintained by medicine, they can do sarvangasana if they're fit. But if it's not, then it's not recommended. Because nowadays everybody has high blood pressure. I see people with stress. But if they are in a good shape, they can do. But as I said, we have to always, like how you use the props and those things to make it easy way for the people. So Uttangasana, those are easy way than Sarvangasana. So that's how we have to divide for the benefits and the therapeutic value of the disease for the people who come in your class, because all are not healthy at that point. So with the heavy weights, we want to then give those kind of poses like Viparit Karni, towards the wall you do it. And if the person is fit, you can do the traditional Viparit Karni. So that's how you have to start thinking about teaching the class at that moment.
And so we asked the duration here is 2 to 6 months, about 60 to 90-minute sessions, 4 to 5 days per week in this one study. These are just shoulder poses. This is kind of heading towards a proper fish pose, not quite there, the shoulder pose. So you can see how this squeezes the thyroid. This allows oxygenation. So if you go from one to the other, which in that paper they did, it seemed to be a good way to kind of squeeze it and relax, squeeze it and relax. So
Yeah, Sarvangasana is king of the asanas, they say. You get, because Sarvang means whole body. That's the meaning of the Sanskrit. So if you know the meaning, you will love to do more because it gives the whole body, Sarva Ang. So all the parts of the body when you do that.
Just like Surya Namaskar.
Yeah, but Surya Namaskar, and
Has many
if you
different positions. Yeah.
no, but when you do Sarvangasana, you really know what that
Yeah.
asana, and Surya Namaskar we are doing in the movements, those 12 poses.
Yeah.
But this Sarvang, when you stay there, it's like a medicine
Right.
because you're staying there with the thyroid. So that's the difference.
Yeah, circulation,
all
also
these
blood
things.
circulation to
Yeah.
the brain.
But Surya Namaskar is complete movement, 12 poses. You're not staying there. So you don't feel that effect in your thyroid at that point. See, these are all important things how you compare. That if we are doing 12 poses, you're not getting a lot of it. It's a comprehensive, like, I won't say aerobics because people think that way, but Surya Namaskar, do all 12 poses and you are in that momentum, you're continually moving. But when you do asana is tirtha, so there is a steadiness of the pose. So when you do Padmasana, there is steadiness, right? For example, if you do Sarvangasana, there is steadiness. But
Good
Surya
point.
Namaskar is movement. That's why.
That's right.
So these
Yeah.
all factors helps therapeutically.
So I have a question. I don't know, is it in the radar? You said that Sarvangasana is for overall, you know. So if somebody is suffering with glaucoma or high eye pressures, so
They
can we
shouldn't do it.
recommend them?
Yeah.
They
They
should not do
shouldn't do
it.
it.
Okay.
No, no.
Okay. Okay.
Because
Okay.
when you lift your body itself makes them pressure, because to have your whole body in your support on the neck, it's a lot of pressure in the facial muscle. That's why for high blood pressure, they don't recommend. That's the reason, because it all
Okay.
flushes the blood in your face. So people who have a really bad blood pressure, which are not under control, they shouldn't do it. But there are people, they're very fit with these things, they can do it, but not like all people. So that's why in this they say don't high blood pressure, because you're lifting your whole body itself is a pressure when you do that. While that technique, when you experience, you will know. Yeah, but with the eye problems, you shouldn't. This is a lot of pressure when you lift your body up.
Yeah, because there's the contradiction. For eye treatment, it is said Sarvangashan is good for, you know, far sightedness, or but even they are with glaucoma, then we should not recommend them, right?
Yeah,
Yeah.
it's a different situation.
Correct.
But
Okay.
yeah, it's a different situation. How much damage it is in the eyes, it depends. Like, see, if the people have surgery with the retina, for example,
Okay.
you don't want to put too much pressure on your body if
Okay.
they have done
Okay.
that, if they have treated. So it depends on how it is, the situation of that disease that person is suffering.
Okay. Thank you.
Yeah. But as I said, it gives blood circulation to the eyes. Every poses will help the eyes, because
Okay.
especially, you know, the Shashankasana, rabbit pose,
Yeah. Yeah. I know.
that helps a lot the eyes also.
Okay.
If I go detail, I can explain that once you
Sure.
bend your body head down, and if that person is fit, for example, that he can sit in Vajrasana, say like 3 to 5 minutes, and just keep that head down on the ground. If cannot, you can use pillow. But if you stay there for longer, 2 to 3 minutes, the whole blood circulation starts activating in your brain, and that helps your eyes also in that case.
Okay. Thank you.
Yeah, so this limited people we can always diversify asanas this way with the disease, because it's not going to be easy to do poses for all the people when you come across. So, but these all poses can help them to still get the benefits of the same of Sarvangasana.
The other important thing is, again, to go back to the thyroid, is that if you're hyperthyroid, that's the grave disease where it's high, then again, the shoulder stand is relatively not safe. So just like the eye, even that affects the eye. You know, if you, those people, the eye looks big, just appears big, same reason. And then
Oh, okay.
and they measured the pressure in the eye when you do some of these poses, and I'll look quickly, but some of the poses increase eye pressure, so you avoid them. So, for example, the downward facing dog, they measured and the pressure goes up. Normally in the United, but we're safe. But if you already have glaucoma or pressure in the eye, then you want to not do that. And then the standing forward bend has another one. We talked about shoulder bend and even the plow pose, which makes sense. All those would not be wise. So we want to avoid those. But otherwise, I think that,
So fish pose is safe little bit, because you are doing on the lying down, so you don't have pressure in your face at that moment.
anywhere your head is above your heart, in general, is safe. It's where your head is below your heart. You want to avoid those poses. It's a simple rule. if you have high pressure like glaucoma.
Yeah. So in fish pose, you can rest your head just straight. You don't have to tilt it,
Right.
So be relaxed. Yeah. So you have to diversify, and this comes with the experience and techniques and teaching experience. You can then grow and grow more on it. So, but this I'm just sharing my experience how you can divert with the people if you come across with the disease poses from one to other. Like Sirsasana headstand pose is not, we don't recommend because it's very tough. We are putting the whole pressure on your head when you do that. I mean, we don't have in this curriculum, but I'm just saying, even people practice that. So it's limited to people to practice those. But we have a wonderful syllabus to cover all disease. So it will help one way or other way. Any pose, any yoga pose is not going to go wrong. You are going to benefit one way or other way. Because it's all interrelated. All poses are interrelated.
I do have a quick question. I know when there was mention that certain poses shouldn't be done if the participant has hypertension, is that for like uncontrolled hypertension, or what if they have hypertension but it's medicated, and so it's
That's what I was trying to tell. Like I know, like some people have nowadays. So it's so common to have blood pressure, but they are very fit. So it's okay if they do safely. But if they experience something not they are not happy when they do, then they should stop doing.
oh, so if they
It's
experience any
yeah.
symptoms.
Yeah.
Okay.
So if it's like people who are very sensitive, or could not, there are people with very bad anxiety and very high BPs. There are people in extreme cases, they shouldn't do it.
Okay, thank you.
Yeah. And in that case, mudras, mantras, and meditation helps a lot. And after that, they do asanas, they will be able to get control of it. So that's how it will go in their cases. Because BP, the relaxation pose is the first aid to the people who have very high blood pressure. It comes down immediately once you practice meditation. So once you do all those, and then if you are in control, yeah, then there's nothing wrong in doing other poses if you are in good shape that way. Yes, blood pressure is so common nowadays disease. So they cannot limitize. If you're fit, you can do it. But as I said, if they are anxiety and hyper, has a personality, then don't do it.
So thank you very much for very wonderful talk and very informative talk of Dr. Devendra, including all the scientific modern researches and also the yoga packages, suggesting the appropriate yoga packages, and also to Binaji for sharing her vast knowledge about all the practical benefits of all different yogic practices regarding the particular problem of thyroid. So it was really very wonderful discussion and good question answers. So now should we start meditation session? Yes. So Rakeshji will give session of perception of psychic centers or psychic colors, sorry.
Psychic colors.
Yes.
Thank you. So today we will practice perception of psychic colors, or Lesha Dhyan. The first step is to prepare ourselves for the meditation. So let's stand up for a few seconds and take a quick stretch. Okay, one more time. Now sit down and assume a comfortable posture. Could be Vajrasana or Sukhasana or Padmasana. Choose a posture in which you can sit comfortably for the next few minutes. Position of hands could be either in Gyan Mudra or Vitrag Mudra. Close your eyes softly. We'll mainly practice perception of colors today to practice the steps or the concept, not go into a deep or long meditation. There are 2 steps to prepare ourselves for the actual meditation. These are called pre-meditation techniques. The first one is Kayotsarg, or relaxation. In this relaxation, we will visualize all the parts of our body and suggest them to relax. We'll start with the big toe on the right foot. Focus your attention on the big toe of the right foot and suggest it to relax. And similarly, the other toes, the entire foot, calf muscles, knee, thigh muscles, and the hip joint. Feel that the whole right leg is now relaxed. And now we will move on to the left leg, again starting from the big toe. Focus your attention on the big toe, the other toes of the left foot. Suggest them to relax. And the entire foot, ankle, lower calf muscles, upper calf muscles, knee, thigh muscles, and the hip joint. Feel that the whole left leg is now relaxed. Now we will move on to the middle part of the body. Concentrate on the lower abdomen and visualize all the internal organs. The large intestine, small intestine, kidneys, liver, spleen. Suggest all of these organs to relax. The chest muscles, the heart, and the lungs. And moving on to the neck area, our vocal cords, thyroid area. Suggest all of these to relax. Now the arms. We'll start with the right arm, the thumb, and the fingers of the right hand, the palm area, wrist, lower arm muscles, elbow, upper arm muscles, and the right shoulder. Suggest all of these muscles to relax. And bring your attention to the left arm. Again, starting from the thumb and the fingers of the left hand, the palm area, the wrist, lower arm muscles, elbow, upper arm muscles, and the left shoulder. Suggest all these muscles to relax. And now the back muscles, the spine area, the whole spinal cord and the vertebrae. Suggest all these muscles to relax. Now the facial muscles, the cheeks, muscles near the ears, forehead. Feel that there is no tension in any of these muscles. They are fully relaxed. And the head muscles. Feel that the whole body is now completely relaxed. There is no tension in any part of the body. Also make sure that you are sitting erect with your spine and neck in one line. The next step in pre-meditation stage is the Antaryatra. Sorry. Antaryatra or internal trip. This we will begin at the bottom of the spinal cord. Focus your attention at the bottom of the spinal cord or Shakti Kendra. And slowly move your attention along the spine upwards towards the top of the head or the Gyan Kendra. While inhaling, we'll go back to the Shakti Kendra. While exhaling, we will move along the spinal cord and try to pull that energy towards the Jnana Kendra. We'll do this for 1 minute. And now we will practice perception of colors. And today we will practice perception of red color. Red as in the color of the rising sun, bright red color or deep orange color. Visualize deep orange color at the center of intuition, that's between your eyebrows. Darshan Kendra. Visualize rising sun colors at the Darshan Kendra. Bright red color. It's appearing on your Darshan Kendra and spreading throughout your forehead. Darshan Kendra is situated 4 fingers inside your head in a straight line between your eyebrows. Imagine that the bright red color is infusing all around you. And you're inhaling bright red color. Red color is associated with the power of intuition. Darshan Kendra symbolizes intuition. Imagine you're sitting in a cloud of red color, bright red color. If you are distracted, no worries. Try to bring yourself back into meditation by visualizing the red color. Now we will conclude today's meditation. We'll rub both our palms together. Place them over our eyes and slowly blink our eyes and open our eyes.
Thank you.
Thank you.
Thank you, Rakesh bhai.
Samiji, I forgot the Om recitation.
Okay. So yeah, next time you can keep it in mind.
Ji.
Yes. So thank you. Now who will give the next session next tomorrow? Who is ready? Sheetal.
Jivandami.
Okay. So next color, which is not covered, you can take that.
Okay, Vandami.
So thank you. Thank you for all wonderful sessions, discussions, sharing the knowledge.
Vandami Naman Swami.
Yes.
Vandami Naman Sami Samiji.
Thank you. Thank you. Thank you.
Representation,
what is right?
Yes. Thank you very much.
Thank you, very nice.
Samiji.
Very calming.
Thank you.
Thank you, Samiji.
Thank you.
Thank you. Thank you.
Thank you. Bye.